This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Something I was thinking about, because we have these patients that come in often that it's kind of difficult to have a good framework for, and it's cancer patients. So when you have a cancer patient, there's a couple of emergencies that I think of that are specific to cancer. And if you have a little framework for it, it kind of helps with thinking about how to take care of them. Do you guys have any cancer emergencies in your mind? Sepsis is a great one.
What counts? Neutropenic stuff?
Yeah, neutropenic fever, that's another common one that's important to evaluate. Do you guys know any other cancer-related emergencies?
Would you get like an emboli?
Yeah, totally. So they're more hypercoagulable. So blood clots, pulmonary embolism in particular. Any other ones? So the way I think about it are in a couple buckets. I think about it in terms of infection, which is what you're alluding to, with sepsis, neutropenic fever. Then I think of obstruction, so like blood clots, SVC syndrome, even tamponade. And then I think of metabolic complications. So the big ones are going to be hypercalcemia, and then also patients who are getting treatment for cancer can have hyperkalemia from like a tumor lysis syndrome. The only other thing that's weird is in patients that are on these immunomodulators. Big one is Keytruda. Those ones can cause basically inflammation of any organ. It causes itis of like anything. And if a patient is on an immunomodulator and comes in with something inflamed, literally essentially anything, it's worth it to talk to the oncologist and ask about steroids, because they could be having basically a bad drug reaction from it. So those are the basic things I think of: infection, obstruction, and metabolic complications, and then medication side effects.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.